Joining us this morning on The Blend, we have Joseph Mead with us, who is the CEO of Careline Health Group Hospice and Physician Services. Joseph, thanks so much for joining us. I know last time during our interview, we talked about how Careline Hospice takes an innovative approach to hospice care. So I'm wondering how Careline Hospice prepared for and adapted to the challenges of COVID-19.
Well, it's a great question. And Bob, thank you so much for having me back. As we said last time, innovation is a cornerstone of Careline Hospice. But one of the other cornerstones is taking care of patients. And just like a snowstorm, it doesn't really matter. You have to get out there. You have to take care of our patients. So some of the things that we did is we moved early. Our task force actually met March 3rd, was the first date. It was about 2 weeks before the state shut down. And that enabled us a little bit of a head start to make sure that we had PPE, that our team was protected and safe. And we've cared for COVID patients throughout the entirety of this pandemic. We've not turned away anybody. That's our calling, that's our mission, that's what our team is geared up to do, is to go help people in the home. And it's been wonderful to see the team's approach.
So, what changes in health should families and caregivers pay attention to that may indicate that their loved one might qualify for hospice care?
It's a great question, and it's actually gotten harder, not easier, in the face of the pandemic. With people at home, there's a greater deal of isolation. There's fewer eyes on the frail, on the elderly that may qualify for hospice services. And it's challenging. And so some of the things that we coach families on, that we educate families on, are to look for changes. And you said it, Bob, it's really the changes in condition that you want to look for. But what changes? Everybody changes every year. There's three that really stand out. The first is unintentional weight gain or weight loss. Weight loss is usually what you see, but weight gain is an important indicator as well. The second, falls. As our bodies age, as we age in place, we're more and more prone to fall, doing the simple tasks, the simple activities of daily living. Keep track. For your families at home, keep track of the number of falls that you see over a period of time. You see increases in falls. That is the number one indicator that someone may start to turn towards eligibility. And then the third is ER visits. And sometimes those go hand in hand with falls, unfortunately. But unexpected trips to the ER, unexpected events, those are very important indicators that there's something going on. We don't know exactly what from that, but that's the trigger. That's what your families need to be looking for in order to call and see if they may be eligible for extra help. This is all about additional care and additional help and in seeing it early.